Hi, this is Dr. Robert Ellul, and today I would like to talk to you about how treating diabetes affects cardiovascular risk. For many years, studies have linked diabetes with increased cardiovascular risk, that is, the risk of getting a heart attack or to die from one. However, whether controlling blood glucose reduces this risk has been less clear. Results from the UK PDS study suggested that in type 2 diabetes, improving glucose control did not reduce cardiovascular events. The only benefit was shown in patients treated with metformin. In type 1 diabetes, the DCCT and EDIC studies demonstrated long-term benefits from lowering blood glucose, but this was only apparent after many years. There are two large studies that examined the effect of blood glucose control on cardiovascular disease. These are the ACCORD and ADVANCE trials. Both compared standard and intensive treatment in type 2 diabetes, and the strength of these two studies lie in the large number of patients involved as well as the long period of follow-up. Both studies included people with and without pre-existent cardiovascular disease, and so the effect of intensive blood glucose control could be studied in both groups. The most important and surprising result of both the ACCORD and ADVANCE trials is that strict glucose control did not result in decreased cardiovascular risk. The second, and perhaps even more worrying finding of the ACCORD study suggested an unusually high rate of death from cardiovascular disease in the group of patients with tight glucose control. This was the very result that the study was designed to avoid. It is helpful to look at some differences between the two trials, which may help us understand some possible reasons for these findings. First of all, patients were treated with different combinations of drugs to control blood glucose. Of note is that glitazones were used to a greater extent in the ACCORD study. Secondly, other cardiovascular risk factors accompanying diabetes were not optimally treated. Lastly, the initially set targets of glucose control were well met on average in ADVANCE, but to a lesser extent in ACCORD. ACCORD was also terminated early due to unexpected or presumed cardiovascular death. So what are the possible explanations for these findings? Glitazones were used more heavily in ACCORD. Rosiglitazone was shown to be associated with significant risk of ischemic heart disease, that is, heart attacks, although researchers found that this was not the case in the ACCORD trial. Patients in ACCORD had significant weight gain, in contrast to negligible weight gain in ADVANCE. This was attributed to glitazone and insulin use, and can potentially reflect changes in body fat and cardiovascular risk. The most probable explanation to the unexpected deaths in ACCORD is thought to have been related to hypoglycemia, that is, when blood sugar levels drop too low. Insulin and sulfonylurea combinations were routinely used in this study, and this combination is known to cause hypoglycemia. The Veterans Affairs Diabetes Trial, another large trial that looked at cardiovascular disease outcomes with good compared to excellent glucose control, supported the hypothesis that hypoglycemia is associated with increased cardiovascular risk. Furthermore, the trial suggested that the duration of diabetes affects the benefit from good blood glucose control on cardiovascular disease. In fact, people with shorter diabetes duration will reap more benefit from tight glucose control. So at this point, one may ask whether blood glucose control is that important to reduce cardiovascular risk in diabetes. Well, the answer is yes. Blood glucose control is still important, and it should be clear that these studies do not try to undermine the importance of good blood glucose control. There are cardiovascular risk benefits from good glucose control in the long run. We must also not forget the clear benefit on eye, kidney, and nerve complications that would ensue if diabetes is not controlled. The first important lesson to be learned from these studies is that as regards cardiovascular disease in diabetes, we have to be careful to avoid hypoglycemia in order to reduce risk. For this reason, treatment of diabetes should be tailored for each and every patient, with special care and not so stringent glucose targets in those at risk. Another important lesson is that when it comes to reduce cardiovascular risk in diabetes, one must take a multifactorial approach. This has also been supported by large studies, such as the STENO2 study. This means that in diabetes, it is very important to control other accompanying cardiovascular risk factors, such as smoking, blood pressure, weight, and blood cholesterol levels. Thank you for watching, and I hope that this video was useful to help you understand better how treating diabetes affects the risk of cardiovascular disease.